So I would like to welcome Rajanna Emhoff, Associate Professor of Kinesiology and the Director of Health Science, and Maria Teresa Rajanna, Pre-Med, Pre-Health Advisor in the Career Center. And they'll be presenting on college-wide support system for pre-health students. Thank you.
Thank you. Good afternoon. Thank you, Margot. Maria and I are really excited and we're really grateful to have this opportunity to share with you some of the work that we've been doing. This is an accumulation of many people, many hours, many semesters. So this is still just kind of a work in progress of everything we're sharing with you today. But despite this beautiful infographic, which is also on your table, I left several copies at each table. But for a minute, I just wanted to address the big picture of why this is an important conversation for staff and faculty to be having. So if you could just put this in your peripheral vision and let's just look at the big picture for a minute. So there are really three main reasons why this is an important conversation to have. The first is when we think about healthcare and we think about everyone's own individual journey towards the best version of their own health that it can be, which is different for you than it is for me, than it is for someone else. This is a deeply personal journey. And so having educational pathways and experiences that allow students to be immersed in the study of health towards a career, towards a profession in health, is something that's really aligned with what we already do really well, which is cultivating a passion, teaching our students skills and critical thinking on how to approach problems with a lens of justice, equity, and ethics. So anyone who's ever experienced a health issue in your life knows that these are all part of your core values as either a patient or a family member of someone who is going through some kind of health issue. So our students get that. These Lasallian educated students, they get that naturally. And so you can think of our future students by the time they leave St. Mary's, they're really well positioned to be impactful leaders in a healthcare profession, right? It's whether it's a financial burden, whether it's do I trust my doctor, whether it's is there cultural competence built into my treatment plan. These are all issues that we need through a lot of the courses that St. Mary's students are taking. So that's the number one reason. This is really closely aligned with our mission. The second is that our current academic programs, while they're exciting and they're very successful, they are a little bit redundant when you really look at how the programming works for students as they're declaring majors and preparing for graduate school. There's a little bit of redundancy, and frankly, that's actually a little bit confusing. So when we're talking to students at academic fairs, we're talking to prospective students and their families, even the faculty and staff who are deeply involved in this type of work, we get a little bit confused on how to advise students. So I think we have some area for improvement on how we can streamline the process for academic and career advising for students who are interested in pre-health pathways and make it seamless and almost imperceptible for students to connect the dots. Taking a phrase from one of my former mentors, our goal is to make it incredibly easy for students to find their way. And we know that that's already a difficult enough journey, so what can we do to provide resources and support and remove barriers as much as possible? And the third reason for the big picture is we are talking about a lot of students. So currently, today, if you take all of the students who are majoring in some pre-health major, added to the students who have indicated to advisors, academic or career advisors that they're going to be applying to these graduate professional programs in health, we're looking at 230 undergraduate students, not including first years. So if you include students who are in FYAC cohorts, who are thinking about majoring in a pre-health major, we're looking at perhaps another 100. And then, hopefully after today, some strong recruiting for our nursing program, we're looking at about 400 undergraduate students. So that's a significant population of our undergraduate student population, a significant percentage. And again, today, just looking at the declared majors, we already are dealing with 12% of our undergraduate population who could be directly impacted by some collaboration coordination in this area. So from a faculty perspective, I will say that I feel these silos. The School of Science has a lot of students in these pre-health pathways, but as Maria is going to show you, it's not just School of Science, School of Liberal Arts in Kinesiology, in performing arts, in integral. We have lots of students from SOLA who are pursuing pre-health. We have students in SEBA, business majors, also pursuing pre-health. So having a more coordinated effort from a faculty advising side, I think, is something that definitely needs to happen as well. All right, I'm going to turn it over to Maria to start introducing some of the beautiful graphics that we're seeing behind us. Thank you.
Hello, everyone. Thank you for staying and enjoying your Thursday without students here on campus. However, I'm so glad that there were students actually at the library because shout out to Nolan who helped me with a lot of these copies. So wonderful, wonderful student workers. But I'm Maria, and so I'm one of the pre-med, pre-health advisors. So SMC is very lucky to have actually two. So Dr. Jessica Johnson is the pre-med advisor, but she also helps students and other allied health professions as well, because as she said in a meeting with us, there is a lot of overlap. Total body health care includes dental, physical therapy, mental health counseling, in addition to medicine. So she's my mentor. I'm learning a lot. I'm actually an English major from as an undergrad, but what that tells me is, just like our majors, you can learn anything in science if you have a passion, if you want to help people in so many different ways. So just a bit of a perspective from a staff and a non-teaching role. When a student says, I'm interested in a career in medicine, what I'm finding from the data that I've been collecting over the summer is that you have to have a very clear reality check when a student says, I want to pursue a career in medicine. So what we like to do is bridge the gaps of information. So very much like how Magali was saying, the STEM Center, because she works very closely with STEM students, they need to ask. But actually, in my role, I give a lot of information until they actually tell me to stop because it's too much. But it has to be. It has to be a lot of information because you're making a very important decision because it can actually affect your undergraduate experience. And so what I'm also finding is that this current cohort that is applying, the 2025 cohort, there's roughly 66 students, maybe 61 students that we are actively, closely monitoring. And so we want to see in this new pre-med, pre-health advising series, is this helpful? And if so, what can we do to better it? What do we need to work on so that more students get accepted into these very competitive specializations, especially PA and medical school? So again, being in this space of pre-health, pre-med advising, it is very important, again, to front load and also create access to information. It's important to reach out to other SMC alumni who have careers in healthcare, who are actually a practitioner post-pandemic. And it's actually one of the questions that is asked on every single application for every specialization is, what does the post-pandemic or what has COVID done for you, or how have you been affected by COVID? That's what it was. How have you been affected by COVID, whether that's academically, personally, or professionally? So admissions committees are giving a space for students to write about how they personally have been affected. Did it affect your internship hours, your field placement? Did it affect your mental health because you lost a loved one? So it's a very important focus still in applications. So with the collected data that you see in front of you about SMC alumni that are applying, and they're actually applying 1 to 3 years after graduation. There is one candidate that has applied 15 years after their undergrad degree. So anyone can apply and whatever, as long as you have the passion and the prerequisites for it. But what we also like to emphasize is not only do you have to have the academic checklist, but you also need to, or we also tell students, admissions committees look at you holistically. So they're evaluating you based on your personal statement, your responses to secondary questions, They're also evaluating your interview, like how articulate are you in your interview, what, your quick thinking. So there's a lot of things that we prep students with so that they can be their best selves in front of admissions committee, who are essentially strangers who don't know too much about them, just what they have on paper. Okay. Right now, one more perspective from the student side as to why this is also important to start gathering data, and Shan will share that from the student side.
This semester, we surveyed our pre-health students. We sent out a large Google survey and hounded them with emails to fill it out. And we got a number of responses that told us that most students really need help connecting that academic to career piece. They are looking for ways to take what they learn in the classroom and apply their professional skills in an internship, in volunteering positions, getting clinic hours, shadowing a professional. This is where students are really trying to find that and probably struggling the most. And so this is an area where we could really assist and provide some guidance for students. Another big area that they are confused about is what exactly is the pathway to my end goal? And again, students don't and shouldn't know what they want to do for the rest of their lives when they come in as a freshman, but maybe by that time that they're graduating or as they're having conversations with their advisor each semester, there can be a touch point to say, okay, is this the path we still want to be on? Is there a reason to pivot? Should we look at some other explorations? Do you have room to incorporate other curricula? So these pathways towards a particular grad school seems to still be obscure enough that students are still asking. I still don't know what classes I need to take to go to PT school. So yeah, the information is there, but I think it's hard enough to find that students still don't feel like it's readily accessible. We do have, hopefully, big nursing population coming in, and so there are already students who have heard about this, and so we're getting lots of responses from students about, well, I'm here to get into the nursing program. What nursing program? But they all are talking about it. They're all talking about it. So when we surveyed the students, this came up across like 40% of the respondents. Okay, so students who are here at St. Mary's cannot wait for us to announce the launch of the program. And certainly the Career Center, the STEM Center, all the services that we've heard about today, students have called out as these as being very helpful resources. So I forget who said it, but right, I think it's Magali, if one student has a really great experience with a staff member or faculty member and finds that really helpful, they will tell all their friends, and then the stream of ants will be coming to your office, right? It's just like they will tell each other, and they will peer pressure each other in a positive way to seek help and seek advice. All right, so that's a faculty, staff, student perspective on why this is important. And so now, let's look at the handout in front of you. If you don't have your own copy, please share with someone. But if it's too small, look at here. I know, I was like, can you make bigger font? All right, go ahead.
Yeah. When it comes to collecting data, I have to give a shout out to data analyst Vanessa. Yeah, you girl. It is, well, funny, so I went to a webinar, and the pre-health advisors from Penn State and Princeton both work very closely with their institutional research. So when I said I'm in charge of what, Vanessa, please help me with this. I did, and it's a team effort, right? It's a team effort to sift through hundreds of pages of Excel spreadsheets. How do I make it easy? Plus on top of the stuff that she was doing for the school. So I relied on her, I relied on Eric to help me with the Canva, and then I also just manually counted. I did old school counting because and I was really excited about sharing this information. I also had to get approval by Aaliyah and Vice Provost, because the two advisor portals needed actual evidence that I was the pre-health advisor. And so they had to get the letter, they had to take 6 weeks for this to get approved. So when it comes to student data, there's very much this like gatekeeping. So I pushed my way through there because I said, this is important and we need to know where our students go. So I only have access to where students, our students, SMC students actually go. And so, and there's actually more. So this is why I wanted just to quickly share what is important. First, I want to start with the student. Who are the students that go on to healthcare? And so when I was in the committee meetings with Dr. Johnson, when I'm reading personal statements, when we're doing mock interview, when we're doing exploratory discussions, I am listening and I'm taking notes, like what are the takeaways, using my counseling, active listening skills. And it's this profile that I created, which is they are taking the SMC Lasallian principle, they are taking that motto, enter to learn, leave to serve, very, very seriously. They are world class at serving the underserved. They are world class at being social justice advocates, equity, closing the gap in healthcare. And so this is their way of giving back. And there are so many requirements and so many things that they have to do, but they are still willing to do it. So it's very touching, and it's very inspiring to see, these early 20-year-old, mid-20 students want to dedicate their life to this population. So we should be very, proud of the candidates that go out there in the world in medicine. The other part, so that's the center, that's the heart of our infographic. The other part is the top right. Thank you, Gian. Which are the top programs that the current cohort of 66 students, or 65 I should say, are applying. And like I said, PA is gaining popularity. Then medical school, and that's DO, which is Doctor of Osteopathy, and MD, which is allopathic medicine. And then PT, so physical therapy. There's less than 5 candidates in vet med, optometry, as well as pharmacy. But I'm going to guess, just based on anecdotal evidence and listening to some of answers, is that PA requires less time in school, post SMC, and then also tuition is an important factor. And then also PA, you can, you're not locked into a specialization. So you could be, in dermatology or emergency medicine, or, OB-GYN. So you're not locked in, that's very much like the SMC student. I want to do it all. And PA allows you to do that. The other part that I want to share is the acceptances. Okay, so on your infographic, because it might be too difficult here. Okay. So on the left, on the red line, that is the average submission or designation of schools per one student over the last 5 cycles. So for example, PA school, one student will apply to about 13 schools. And then that's historically. So some apply to more and some apply to less. And then I'll take MD. So MD, so not DO, even though it's medical school, but MD, because it is historically most competitive. One student, on average, will apply to 40 schools. Some more, some less. But it is a lot of schools, and it's all over the US. I haven't yet seen anyone apply internationally. And it's mostly US, and it's mostly in California, which has the highest population, and so therefore the most competitive states. So students, and each application costs money, $100, $150. So it's definitely an equity focus, an equity challenge as well. And then on the right side, which is the blue graph, that one is historically for SMC students for the last 5 years, PA students get accepted, or applicants get accepted by 30%. So that's the average acceptance for PA students. It's the same thing for MD students. And so it's 30%. Yes.
You mean they get accepted at 30% of the school they apply to, or 30% of our applicants are accepted?
Yes, thank you. 30% of our applicants get accepted. So if there's 10 applicants, then only 3 get accepted, okay? It's low. However, nationally, for AAMC, only 40% of the applications get accepted, right? So we're kind of there. You know, yes, we're not getting accepted, but we're not like terribly low acceptance rates historically. Same thing with PA. Historically, only 30% of our students get accepted. However, on the other side, the allied health professions, so optometry, pharmacy, most students have over a 50% acceptance rate, so higher acceptance rates for those. So the schools they apply to, they do get in, right? So so we're hoping this cohort, 2025, closely monitoring how many times do we meet with them, how many series, development workshops do they attend. You know, we're looking at like every single candidate, how many hours in their biology classes are they spending, how many times have they taken the MCAT. So I have another Excel spreadsheet on that one, because they're actually going to be kind of our test class to see what has been the outcome of our high touch point advising from career counselor, pre-med counselor, faculty advising, STEM, high potential success coaches. Like, we are tracking all of it. And so we'll see that. Hopefully we have higher than 30%. So if we can even get like 40%, that's a huge jump for SMC when they only historically accept 2 or 3 students max, sometimes none, which is very, very heartbreaking, right? So we'll see what works, and then we'll report back.
So there are more data here. I'll just say that we invite you to ask Maria questions about the data. Because again, this is just a glance at some of the work that she's been doing. A lot of it is like manual at this point because it's collecting data from different databases and it's coming in all different forms. And so we're trying to answer specific questions that are meaningful for us to take action. So just to close, again, this is work in progress. We invite everyone to contribute, and if you have ideas or ways that you think this could become even more streamlined, please talk to one of us, and we're not working alone. We have groups of faculty and staff who are also involved in this. So just to close, this is one of the resources that we put together this semester, which is a one-page glance at some pre-health pathways. A few caveats that are at the top and the bottom of the page. One is that students really do need to check their exact school requirements when they are applying. While this is a quick glance and a guide, every med school is different, every PT school is different, every OT school is different. So the sooner students can have an idea of where they want to apply, the sooner they can get exact prerequisite checklists and go from there. But perhaps this could at least be a starting place for students, their advisors, whether it's an academic fair, whether it's FIAT cohorts who are just thinking about pre-health. Do I want to go into PT or OT? Those are just letters. What does that even mean? Right? So you can look at the coursework and say, oh, that's actually pretty similar. So maybe I just get started in Gen Chem 1. Okay, we'll figure this out next semester. All right, so you can actually start to plan a graduation route that is something that you keep checking every semester because, of course, plans can change. Students should pivot if they want to. They should explore when they can. But at least this can help provide a glance at some of the common pathways that our students have taken and probably will continue to take in the future. And again, this is not an exhaustive list. And in the end, one of the future goals, maybe I'm looking at Jeff, is that we could build this into Gale Express, right? So students could say, okay, this is it. I am going to go to I'm going to be physical therapy. I'm going to go pre-physical therapy. I'm decided, and we could actually build that into Gale Express. It shows up as a concentration, and then the classes are right there that students and faculty can look at. That could be great. So perhaps something like that where we have a precedence for concentration. So I think it's possible. And other ideas to help, again, trying to make it incredibly easy for students to find their way. I do think we can look at some of the academic programming that exists. If any of you guys have participated in these lovely prototyping sessions, we are brainstorming, right, all different ways to restructure and just creatively think about how academic programs are serving our students. And so this is an area where I think we can be creative to try to align our academic programs with the pathways that students are already asking for and looking for, while at the same time still holding on to the liberal arts traditions of exploration and community and building all the skills that are translatable across multiple disciplines. So that's all we have today. We'd love to hear your questions and continue the conversation well after today's presentation. Thank you.
Hi, I'm Emily in Student Disability Services, and just wanted to thank you for that wonderful presentation and this resource. Something that I'm kind of wondering is if in your research you've come across students with disabilities in the health sciences courses here at St. Mary's, or working out once they've graduated from the programs.
Yeah. So on an application that I've seen, I don't see that. It's usually race, gender. However, in personal statements, just collectively, I do see a lot of invisible disabilities. So a lot of mental health. So there are some that will share, like ADD, ADHD, how that has affected them. But not on the actual application itself. But then again, there also are supplementary questions that students can answer as well, and that I don't see, because they just want help with personal statement, and then they do everything else on their own. But Dr. Johnson may also have, so I can check in with her to see if students have revealed more to her than to me. Yes, it definitely is. I do want to do a deeper dive into underrepresented groups. However, I will say that PharmD, for example, the pharmacy school, has a lot more female representation, which I think is an underrepresented group in STEM. And there's a lot more students who identify as from an indigenous tribe that are also applying. And there are medical programs that are specific to representation in medicine. Yeah. Thanks for the question.
Yeah, thanks for the question. I'll just add that faculty work with the SDS office all the time, and really thank you so much for everything you guys do, because it's like we can only do so much in the classroom with students, and then through advising we can address more of individual accommodations. But through the SDS, we can at least help keep students up to speed while the semester is just moving at this crazy pace. So really thank you everyone at the SDS office for what you do.
I have one more question though. I'm new to this campus relatively, and even I've heard about this future nursing program. So when students ask about that, where should I direct them?
So I have told students, type in nursing department in the SMC, and there is a contact person. So Dr. Lucinda Allen, she's on there. The other part is an option that most students, and to be honest, nursing online, nursing CAS has information about where students go. So I can see the students or the alums, and they usually go to accelerated bachelor's of nursing programs or direct entry into a master's level program. So that's the other option, just in case. But it definitely has increased a lot. So just for students, yeah. They still, although I will mention that students typically still need to do their 2 years of prereqs, and then they get admitted into a program based on, the metrics. So GPA and completion of all the prereqs.
there's a nursing column. That's one place to start. You can see some of the classes don't have course numbers yet because they're currently in development, and UEPC proposals will be coming out probably in the next month or so. It's an awkward position to be in. I'm hoping Corey will give us some guidance on that in a few hours.
You can update us during the social hour.
If I find out.
Yeah.
I'll let him know.
Thank you so much.
Thank you very
Thank
much.
you.